I am here today to describe to you a method that we have developed to significantly help cancer patients in their struggle with the cancer experience. This is a method that has never been used before. It is much superior to a company that is now doing quite well. I believe it's called Health Grades. You might be familiar with it. We do much more than that. I'll describe that to you during the course of this video. As a matter of background, my name is Joseph Masterson. I'm an attorney by profession. I taught law at the Brooklyn Law School as a full professor. I taught law for over 20 years. I am President and Chief Executive Officer of the Misong Cancer Foundation. That's MISONG Cancer Foundation, all one word. You might want to look at our website. It might be a little bit helpful for you. But I got into this because in, I guess it was 2000 and, yeah, it was about 2000, year 2000, 2001. I met a young lady. Here she is here. Her name is Misong. And her picture, by the way, appears in this book, which is up on Amazon right now. It's a book that you can get quite easily. But in any event, Misong contracted cancer and had cancer over a period of 4 years. Came back 3 times. I was with her during that cancer experience, and she finally was defeated by the cancer in 2004 at age 49. Now I can tell you that devastated me. She was married at the time. She was just my best friend. And after I got myself together and I created the Cancer Foundation in her name, I decided to work on something more significant, and that's what we will describe to you today. So if you will be kind enough to listen to the full video and then make a judgment on your own as to whether or not this can be not only profitable, but my main concern is that we can help people with cancer through the cancer experience. So thank you, and the next segment I will discuss a little bit more about the technique that we're using and how that can help people. Thank you. We're back again, and this time I'd like to refer to some charts as something that I, as a law professor, did not like to do. I'd like to let my students believe that I knew everything without looking at a notebook, which of course was not true, but looking at these charts, and I'm going to throw out some numbers at you. Would you be surprised to know that 100,000 people die in this country every year as the result of hospital and doctor negligence? Now, if you multiply that out by 5 years, that's more people dying in the hospitals in our country than died on our battlefields. That's unacceptable. That's a number I didn't know, by the way, when I was going through the cancer experience with Misong. Now, after Misong died, her family contributed a significant sum to the foundation, to the Misong Cancer Foundation, asking us to attempt to determine whether or not some of the variables that I noticed as I went through the cancer experience with her, whether or not those variables contributed to her death, and if they did, how much contribution did they make, and could there be anything done about them? Just let me give you a few examples. For example, if you tell me that you have cancer, and I say to you, who is your doctor? I know that you don't know anything about that doctor. You don't know if he's had a malpractice suit against him. You don't know if he has settled malpractice suits against him. You don't know if his license has ever been suspended. You don't know what his patients say about him, his former patients say about him. Those things you should know. When we went through the cancer experience with Mia Song, I had a doctor in Robert Wood Johnson. And I used to go to the meetings with Mia Song when she would have consultations with him about her cancer and how it was progressing. And he said to her once, he said, look, he said, if you keep bringing that lawyer with you, and I was her friend. I wasn't acting as a lawyer. I was acting as her friend. If you keep bringing him with you, I'm not going to treat you any longer. Now, you don't want to have a doctor like that. So we have identified a number of variables that I'll talk to you about in a few minutes. But the most important thing we did was we took 560, if you can see this rudimentary chart that I've developed here. Not very professional, but nonetheless. We took 560 cancer patients. We hired 3 cancer oncologists. We hired 3 nurses who were experienced in oncology, 1 statistician. I have a master's degree in statistics, so I'm pretty familiar with numbers, as well as law. We took the 560 and we divided them up into 2 groups. Group A, 280 patients, and Group B, 280 patients. And we took our 13, 14, 15 variables, which I'll discuss with you in a few minutes, and this group got no help whatsoever from us. We just followed their progress or lack of progress for a 4-year period. This group was helped by us with all of the variables that we had in our computer database. We followed these people for 3 years. Now here are the variables. Hospital quality, for example, there's another thing. You go into a hospital, and I can tell you that the 10 worst rated hospitals in the country are in the Northeast area here, New Jersey and New York. The worst hospital is in New York. Now you should know the quality of the hospital that you're in. You should know what the death rate is. You should know what the infection rate is. You should know what the hospital policy is if there is infections. We were up in Columbia Presbyterian with Mia Song, and at the very time we were there, they had Legionnaire's disease, and they were not telling patients that they had that in their water system. So these are things you have to know if you're going to be successful in your cancer treatment. What drugs are being used? It will surprise you that the drug companies in the last 5 years have paid $6 billion to doctors to push their medications. That means that doctors are not giving you the drug that they think is the best drug for you. They're giving you a drug that they're being paid to give to you. Now, if that's true, you should know that. And we can tell you that information. We can identify that. Other things such as genetic testing, which we will do. We have a contract with a laboratory in Montreal, and that laboratory does genetic testing for cancer. All of these variables will have some effect upon your progress going through the cancer experience. These were the variables that we tested with the control group, and here are the results that we found. Again, you're going to have to bear with me with the rudimentary drawings here. The CDC predicts that for every 280 patients, and we divided these groups into 280, total of 560 being studied, The CDC predicts that for every 280, predicting for these groups, there should be 1 out of 4 who will die within that 4-year period. Group A, the group that didn't get any help from us, 218 lived and 62 died. They were a little bit better than the CDC prediction, which was that 70 would die. That 62 died in this group. In our control group, the group that we gave the information to, 268 survived and only 12 died. A 500% improvement over the group that got no help from us. In the next segment, we're going to discuss the app that we're developing and how we can market this, and we can not only help cancer victims to survive, as we did in that control group, but also we can increase our revenue base and make an investment in this company attractive to you. I would just remind you that Healthgrades, and you may, if you're not familiar with it, take a look at it. It's on the big board. It's making a lot of money, and all they do is tell you a little bit about your doctor and a little bit about the hospital, and guess who's providing them with that information? The doctors are. We don't do that. We are independent from the doctors, and that's some of the key that I think you'll be interested in. Thank you. I'm back again. This is part 3. I'm going to discuss with you the website that we're developing. This is a website that is connected with the Meson Cancer Foundation. We probably see it as a subsidiary company. It is a for-profit company. We're going to make money out of this site. And here's how it works. It's going to be called Click for Survival. We have the mark registered, so we're protected with it. And what happens is the patient comes to the site, gives us basic information about themselves. We then give them a password. We, of course, now have their information in terms of how to get in touch with them. And as soon as they do that, we then provide them with 3 choices. Choice A, we will ask them to identify their doctor, the hospital, and the medications that they're taking. We will run that through our database. We will find whether or not this doctor has any problems, or whether or not the medication is the medication they should be taking, or at least it's appropriate, what kind of hospital they're in, and we will give them that information, and on top of that, make recommendations to them. That will cost them $250 to have that done. Choice B, on the other hand, at a price of $600, we give them all of this information, plus we go through our entire database and make new recommendations that they should follow in order to increase their cancer survival chances. Now, this is a significant amount of information that we have developed and we can now access, at least for the 3-state area that we studied in the groups that I mentioned before. So we have this information for Pennsylvania, New York, and New Jersey. We have it in terms of all the doctors who are there, the hospitals, the medications that are being used, whether any doctors are receiving monies to have them push product. We know all of this. Now we can provide that for Group B. That's at a cost of $600. At a cost of $800, we do all of that, plus we do a genetic testing. We also have a monthly newsletter which is related simply to their problem, and we have a follow-up by one of our oncologists monthly to make sure that their progress is going in the right direction. If something goes wrong, we make a change. One of the worst things that we found in our survey was what we call physician adherence complex, which means that patients are really reluctant to leave their doctors, even though everything's going wrong for them. Major, major mistake. So those are the choices, and that is the cost to them, $250, $600, or $800. And now I'm going to talk in the next and final segment about the revenue stream. Okay, I will now discuss with you the revenue stream for the three-state area that we have studied and the area that has its information in our computer database. There will be, according to the CDC, 25,000 new cancers per year in that three-state area. Existing cancers in that three-state area are 80,000 people. So there's a total of 105,000 total cancer patients in New York, Pennsylvania, and New Jersey. We conservatively, and this is a conservative estimate, expect that we could capture 20% of that market with good advertising. That's really why we need the money. That's a 21,000 client base times 400. We use that as an average. We averaged out the three numbers that I gave you before. Comes out to a little higher than 400, but I'm going to use 400, which is about $8,400,000 per year in revenue, just based upon the information that we already have, and information that only has to get out into the public through radio, possibly television, and print advertising. If we can do that, we are confident that we can bring in over $8,400,000. Now, let's just think about projecting that into the 50 states. And that's really another thing that we would like to do. Instead of having information only for a three-state area, we'd like to have information for a 50-state area, and we think that's going to take us about 3 years to develop all of that. Now, if we do, the existing cancers, and by the way, every year, according to the CDC, there is 1,200,000 new cancer victims. Existing cancers, 30 million. So that would be 31,200,000 people in the U.S. would be suffering with cancer, either new cancer or existing cancer. Now, assuming again a 20% capture of that audience, we're talking about 31,200,000 cancer victims that we would capture in 2015 at $400, which is a total of $249,600,000. Now, I want to point out to you that that, in my opinion, is a conservative capture. I think if we did serious advertising, we could possibly get 50-60% of that market. Health grades, and I'm going to get back to them again, and I don't mean to disparage them. I'm sure they're a very good company. Health grades has revenue in excess of $250 million a year. It's on the big board. And all Health grades does, if you come to the site, is tell you something about the doctor and something about the hospital. And then they have advertising all throughout their sites. We are 100% better than that. And we can help cancer victims better than Health grades can help anyone. And it doesn't have to just apply to cancer. We could broaden this out to anyone who has a serious illness and wants to know something about their doctor, their hospital, the drugs that they're taking. Look at Joan Rivers, for example. Look at how foolish she was not to make sure that the doctor and the, I guess it was an adjunct type of hospital that she went to, was good and effective. What do? She has a minor throat procedure and she dies. We want to avoid that kind of thing, especially with cancer patients. I can tell you that if I had this information when Mia Song was going through her cancer, she would have survived. because we had poor doctors. The hospitals were bad. The nursing staffs were indifferent. So we want to do something about that, and we need your help, and that's basically why we're here. Finally, what do you get out of this? We will issue what we call certificates of participation to anyone who invests in the foundation. The certificate will bear an interest rate annually of 8.5%, and it is fully redeemable within a 3-year period. We will also issue stock at $20 per share, and you can take either the stock or the certificate of participation. We're going to have a limited amount of stock so that when we go public, and we intend to, the original investors will do quite well with the shares that they hold. And that will be an intentional configuration that we will make sure is built into the whole system of participation by the investor. So there it is. Click for survival. You're going to hear about us. We're going to get the money. Hopefully you will help us. And I thank you for listening, and I thank you for your help. Goodbye.